So good morning or good afternoon or good evening to everyone that's downloaded this video. We're very happy you've done that. This YouTube video serves as another opportunity for ARC to present to you and provide to you the various unbelievable solutions that our business partners offer our residential communities and their residents. And this particular session that we are doing today shouldn't be longer than about 10 or 15 minutes, is discussing telemedicine, which for me, when I first heard about it, was a wow thing. And I read up about it, and I did some Google searches, and obviously we know the organization telemedicine is involved with, which is Healthforce, and I became so super excited by it. So we have today with us Saul Kornik. Saul is the CEO of Healthforce, and we're going to be dealing with a few issues around telemedicine and how it can be rolled out with unbelievable results and value to your owners. So welcome, Saul, and thanks for joining us today.
Thanks, Jeff. I appreciate being here.
So let's kick right off. You know, COVID's the big part of COVID, and the major lockdown has worked through its process. We still fall under the Disaster Management Act. We still got to comply with various protocols in that act. We hear our state president or our president talking to us so often about where we are. We've heard that in the Eastern Cape there are huge problems. We know that across the land there are huge problems. We all expect a new upsurge in it if we follow the experts on this. And for those reasons, telemedicine as a concept, as a solution, has become the rage since COVID forced us in many respects to think twice about going to our doctors, and in many instances Saul even prohibited us at the early stages, and to an extent now, from making unnecessary trips to doctors and to hospitals. But you guys have a different approach to what emerged as this rage in relation to telemedicine. It's a different approach. Can you talk to us about what you guys do in a nutshell and how it differs from the traditional approach to this?
Sure, no problem, Jeff. I think what I'll do is I'll start by describing what we do, and then what I'll do is I'll contrast it to the various forms of telemedicine that are available today, the kind of forms that have proliferated for the reasons you've discussed. Healthforce's solution is specifically focused around supercharging nurses to be places of specialist care. So what that actually looks like in practical terms, you can imagine one of the members of your residential community coming into a clinic on the grounds of the residential community, going in to see the nurse without an appointment, and we set the nurse up through our application to do top of scope practice, which means the nurse will do as much as the nurse can do for you before she refers you on. That means providing you with recommendations for certain drugs she can, taking pictures of whatever the issues are and putting it into a patient record, keeping a medical history for yourself, giving you an attendance certificate, and keeping a vaccination chart for your children. All these things the nurse can now do from the local clinic in the community. But the kicker is that at the point where she cannot diagnose or she cannot prescribe, she clicks a button, and without an appointment, without a booking, on average 1 to 3 minutes later, a doctor's face will appear on a flat screen TV in that clinic room in the residential community. Wow. That doctor, a general practitioner situated anywhere in the country, will be able to see the nurse and the patient. The nurse and the patient will be able to see the doctor. The doctor can also see all the medical history of the patient as well as the notes the nurse has captured. And from there, a three-way consultation ensues. The doctor can provide a script, a referral letter, or a sick note. Referrals can be done for radiology, pathology, or to specialists and physical doctors where necessary. And once the doctor's completed with their part of the consultation, they log off and the nurse concludes printing out those documents in the clinic room for the patient. So now you've got a situation where without a booking, you can see a doctor within minutes, but more importantly, where the nurse can help that residential community member. It's done much more effectively and at a much lower cost. So let me contrast this now to other forms of telemedicine out there. Essentially, broadly speaking, there are two forms of telemedicine. The first is direct-to-patient telemedicine. That's where you use your cell phone, you call up a doctor on your cell phone, and you have a conversation with that doctor talking about the healthcare problem that you need solved. That is the form of telemedicine that we've seen proliferate since COVID came about. It's convenient, it's quick, however, it's just as costly because the doctor still needs to do the full medical history for you and still needs to spend all the time with you doing the diagnosis. That's the first issue. The second issue with it is a limited amount of things that doctors can really do over a telephone with a patient where they cannot touch you, where they cannot take your blood pressure, your pulse, palpitate your heart, your chest, your abdomen. So there's a bunch of things that the doctor cannot do in that situation. And then lastly, what we're finding is that South Africans actually still want healthcare where humans touch them. And so the concept and the experience of calling a doctor over a phone is quite impersonal. Our form of telemedicine, this nurse-led route, is different because firstly, we have a nurse providing hands-on care. Second of all, that nurse can do all the physical examinations, do the urine dipstick samples, even take the bloods that are necessary for the doctor to do everything the doctor would normally do, short of a few things, in their own practice. So the doctor can now provide a full suite of diagnoses. And then finally, because the nurse is doing most of the consultation and the doctor is only needed to provide the diagnosis and the script, much less of the doctor's time is required. And so we're able to drastically reduce the cost of seeing that doctor.
That's unbelievable. So you did right. If I have a consultation with my doctor, I can open my mouth as wide as I want. He cannot see or she cannot see behind to check the level of inflammation. However, if I'm talking to a nurse, the nurse can, using the right language, using all of their knowledge and skills, explain to the doctor to make the doctor understand what a likely solution is to my throat problem. And I can do that on the estate at which I am based. Simply.
Absolutely.
That's exceptional.
It is. We've also got a number of digital devices integrated with our system. So at times the nurse may describe through their professional language what they are seeing in the physical examinations. But we also have integrated scopes that allow for the looking inside the ears, the throat, the nose, and taking high resolution pictures of the skin. And even where the scope isn't available, the nurse can upload pictures through her cell phone. That really helps the doctor in making a diagnosis.
That's unbelievable. So we've got estate managers that are going to be watching this right now, or directors of estates, and they're interested. Obviously, they phone you or they email you and you'd be happy to assist them. But broadly speaking, to get them excited about giving you that call, how would one set up such a service in a residential estate? So they have an estate, they have a clubhouse, they have a community center or an HOA office. How does one start? Where does one start in relation to an owner having the opportunity to access this service?
It's a good question. Let me preface the answer by saying that Healthforce internally is continually talking about how we make things easy for customers. How do we make it easy for patients to access care, for doctors to practice and nurses to practice, and also for the likes of your residential community managers and owners to actually implement services like this. Actually, through your organization, through ARC, we did an assessment of residential communities, and we found that most residential communities don't actually have nurses of their own right now. Okay. If that is the situation, we can help that residential community set up this clinic I've just described, as long as a room can be made available for the nurse to practice from. Yeah. Healthforce has a subsidiary that can help them provide the nurse for the clinic, can do the installation of that room to be set up as a clinic, and of course to install all the equipment that is needed around the provision of this telemedicine service from the doctor. So there are two options for your residential community managers and owners. The first thing is they can hire the nurse themselves, they can pay that nurse's salary, and then as the members of the community use that service and pay for the service, the residential community can actually make a profit from running that clinic on their premises. The second option, if they don't want to take the risk of managing a nurse-run clinic, is that we can install a nurse who runs that clinic as her own business and keeps the profit for herself. In that situation, the residential community doesn't take on any financial risk, but is still able to provide that service to their members. We have a track record here. So, when it comes to why people like your residential communities would use a Healthforce service, particularly the members in those communities, we found that demographic of population uses Healthforce for three reasons. The top reason is that those residential community members will find it much more convenient to pop into the local clinic at the clubhouse than going across the road and parking and finding an appointment with a doctor somewhere there. The second reason is because it is lower cost. And as much as I understand the demographic of residential communities can usually afford private care, the economic environment in South Africa is becoming tougher and tougher. And if we can offer a service that at best is 25% less than a GP, and at best is 75% less than a GP, and at worst is only 25% less than a GP. That's how low cost the service is. We really believe we can help the residential community members. And then finally, Healthforce is actually reimbursed by, at this stage, 8 different schemes and primary care insurers around the country. That includes Discovery, which means that if you set this clinic up in your residential community, Discovery members and the other scheme members who reimburse us will pay for your members to be seen in that clinic for free because it is a Healthforce setup.
Okay.
I'll paint a quick story for you. Can you imagine a mother at work, a father at work, and their teenage child has just come in from school, it's got a stomach ache, not feeling very good. Now, to go to a doctor, even if it is across the road, is a big logistical mission for a working parent.
Yep.
Instead, that teenager can just walk down to the clubhouse, pop in to see the nurse without an appointment, see a doctor almost instantaneously if necessary, and be treated there and then.
So, you know what? I'm thinking now, it's not only for the homeowners and their families. What about domestic helpers that would normally have to go and sit and wait in a queue at the local hospital, have to take 3 taxis to get there, generally have a whole day out of work? The domestic servant, or the domestic worker rather, that gets sick during the day could then access that. What about the security personnel that is hired by the estate, their workers, the staff of the homeowners association? I mean, it's endless. So it's unbelievably powerful, this, Saul. And I didn't realize the extent and the options one has. So if a particular community doesn't know whether it would be taken up in totality, although a survey prior to launching would be really important to find out if homeowners are going to use it. But I mean, for me, it's a no-brainer, and this is why. And this is why we bring these solutions to homeowners associations, because it's adding value to ultimately the people that pay the levies, which is the homeowners, their staff, their families, and their friends that are visiting at a particular time, which is wonderful.
Absolutely.
So on the question of legality and credibility and all of those things, are there any risks? And if so, what are they? So here I am, my child is sick, the dad's at work in Cape Town on a meeting, mom is out shopping or visiting or working, the kid gets sick, the domestic helper phones and says this kid is sick. Are they secure in terms of the risk management of this rollout, Saul?
That's a good question, Jeff, and it's been probably the primary focus for what we've built so far. Everything that has been built in Healthforce has been fully vetted by the top healthcare legal experts in the country. Let me start by describing our track record to give you some comfort that Healthforce is not just a fly-by-night. In fact, we've captured over 1 million nurse consultations on the Healthforce system since our inception. We've delivered now close to 100,000 telemedicine consultations. We are implemented in over 430 clinics nationwide, including in Dis-Chem, in Medicare, in SPA pharmacies, and the like. So we're being used by some big, credible listed companies. And then, as I mentioned, our service is also being reimbursed by 8 different schemes and primary care insurers around the country, including the biggest. In addition to that, what I can tell you is that after every consultation with a doctor and a nurse, Healthforce asks the patient to rate that experience. And the average rating of patients' experiences with our doctors sits at 4.95 out of 5. So that should hopefully give you some comfort that our track record, the quality of our service, the kind of partners we work with, means that there must be something of substance here. In terms of the actual legal compliance, we have been reviewed by the HPCSA registrar who came through to see our service. We're in compliance with the South African Nursing Council regulations, Pharmacy Council regulations, and we've done a deep dive on a number of acts to make sure we're in compliance with them. That includes Health Professions Act, National Health Act, POPI, PIA, Electronic Communications and Transactions Act. I can keep going. But essentially what I'm trying to say is that it's completely legal from a clinical perspective, and it is completely legal from a patient privacy and security perspective, which is very, very important. There are risks, nevertheless, when you encounter the healthcare system, right? There's always the risk of a clinician making the wrong diagnosis. So let me first say talk about that in relation to the residential community. The nurses that practice and the doctors that deliver the telemedicine service are independent practitioners. That means that should something go wrong, it never has in all the years we've been working, but if something should go wrong, the residential community will not be held liable. Okay. That's the first thing for residential community owners and managers to understand. The second thing is that we vet the healthcare workers that come onto our system, and we continually do clinical governance with them and quality management with them. In fact, for every 20 doctors that apply to work on Healthforce, we generally select 1. And then we monitor those doctors. We're getting real-time feedback from the patients and how they're doing. So we've got a number of quality measures. The doctor practice in the background is continually doing work and sharing lessons they're learning on how to deliver services in telemedicine. Nevertheless, if something does go wrong, the medico-legal implications of that are the same as if you'd gone to your doctor and they had made a mistake. That doctor can be held liable for the work that they've done, the misdiagnosis they've made, equally with the nurse. So it's really exactly the same as if you'd gone to a normal doctor practice.
But the convenience is there, the peace of mind is there. We're not sitting in a large waiting room with many other patients that have got sniffles and coughs. We're going up to a carefully selected space, and all our communities have that space. There's always something, and one could not have it as a permanent space, so one could have the nurse that would perhaps, I would assume, be on duty Mondays, Wednesdays and Fridays, especially in the beginning, which would then land up, if it is successful, which I'm sure it is going to be, with a full-time nurse that people can then quickly phone and say, are you free? I'm popping up. Or if there's an emergency, just go. Get in your golf cart and just go.
Absolutely. By the way, our doctors are available on Saturdays and Sundays. They're also available into the evenings up till 7 p.m. So you can also now, those aren't times you'd normally be able to go and see your local GP.
No, guaranteed not. You would have to land up by going to an outpatient somewhere. You'd have to put up a couple of grand security, and you would have to sit and wait for the doctor, because that doctor's on a Sunday evening doing his or her own thing. So generally, so it's a no-brainer, and Saul, what you've explained to us today is unbelievable, and I would urge every single one of our members to contact Saul. At the end of this video, all Saul's details will be up, and you can contact Saul or probably one of his representatives in the organization, and they would be very happy to have a chat to you to explain it in more detail if you need it in more detail. So thanks, Saul, so much. It's really, really appreciated. and we
I really appreciate the time, and I really appreciate the opportunity to be able to talk to your members. I really think this is a service that can help, not just, actually, as you just pointed out, not just the community members, but the staff that work for them as well, who lack access to healthcare.
Correct. Well done. Thank you.